Hello, everyone. My name is Lily Schmidt-Swartz, and today's certification training focuses on Medicare coordination of benefits. This topic addresses how Medicare works when a beneficiary has more than one type of health coverage. Coordination issues arise frequently. Many Medicare beneficiaries continue working or are covered through a spouse's job. They may elect COBRA, receive retiree benefits, qualify for Medicaid, or have federal or military coverage. When more than one insurance plan is active, it becomes essential to determine which insurance pays first. If coordination rules are misunderstood, beneficiaries may delay enrollment improperly, face late enrollment penalties, experience denied claims, be billed incorrectly, and have insurers recoup payment. So today we are going to really build a structured approach to analyzing these cases so you can confidently guide beneficiaries and prevent harm before it happens. The Medicare Rights Center is a national nonprofit consumer service organization dedicated to ensuring access to affordable health care for older adults and people with disabilities. We advance this mission through three main areas: counseling and advocacy, which is direct assistance to beneficiaries. Second is educational programs, including trainings like this one, public policy initiatives working to strengthen Medicare protections, and coordination errors are one of the most frequent issues seen through our helpline. Much of that harm is preventable with timely and accurate information. By the end of this training, you're going to be able to determine whether Medicare pays primary or secondary, explain Medicare's coordination with job-based insurance, COBRA, retiree insurance, and Medicaid. You'll be able to understand what credible prescription drug coverage is and how to use the Part B special enrollment period appropriately. These objectives are practical tools. When applied correctly, they directly prevent enrollment penalties and billing disputes. Coordination of benefits refer to how two or more health plans share the cost of health care services. When a beneficiary has Medicare and another type of insurance, one plan is designated as the primary payer. The other plan becomes the secondary payer. The primary payer processes the claim first. The secondary payer may then cover some or all of the remaining cost sharing. However, coordination rules are not uniform across all situations. They really depend on specific factors, and we're going to break down those factors. So, how other health plans coordinate with Medicare depends on whether the person's Medicare eligibility is based on age, disability, or ESRD. Also, the kind of plan, such as group health plan or retiree plan, whether the coverage is based on current employment, and of course, the size of the employer. These distinctions matter because employer size directly determines who pays first in job-based insurance scenarios. When a beneficiary has both Medicare and another insurance plan, Medicare may pay either primary or secondary. Primary insurance pays first on claims. Secondary insurance pays after the primary plan. Secondary coverage may cover deductibles, coinsurance, or copayments, but it does not guarantee full payment of all remaining costs. An important nuance is if the primary insurer denies a claim, the secondary insurer may or may not make its own determination. If Medicare should be primary but Part B is not active, the secondary plan may refuse to pay. If an employer plan mistakenly pays primary and later learns that Medicare should have paid first, it could recoup payments. And that is why enrollment timing is critical. Credible drug coverage is prescription drug coverage that is considered at least as good as the standard Medicare Part D benefit. The types of coverage that often qualify as creditable drug coverage include Veterans Affairs benefits, TRICARE for Life, Federal Employees Health Benefits Program, some employer-sponsored plans, and some retiree plans. If a beneficiary has creditable drug coverage, they may delay enrollment in Medicare Part D without incurring a late enrollment penalty. Employers and plan sponsors are required to send an annual notice, usually around September, informing beneficiaries whether their drug coverage is creditable. Beneficiaries should keep this notice as documentation. If a prescription drug coverage later ends, proof of prior creditable coverage may be necessary to avoid a Part D late enrollment penalty. Advocates should always ask, do you have documentation that your prior drug coverage was creditable? If a beneficiary loses creditable drug coverage through no fault of their own, they have a 2-month special enrollment period to enroll in a Medicare Part D plan. If their drug coverage is reduced and becomes non-creditable, that also triggers a 2-month special enrollment period. If the lost coverage was not creditable, the beneficiary may still enroll in Part D, but they will owe a late enrollment penalty. Ultimately, timing is extremely important. Missing the 2-month window can result in delayed drug coverage and penalties. Job-based insurance is health insurance offered by an employer or union on current employees and their families. You also may hear it referred to as current employer insurance, group health plan, employer group health plan. How Medicare coordinates with job-based insurance depends primarily on employer size and whether the individual qualifies for Medicare due to age or disability. This is one of the most common and most misunderstood coordination situations. If an individual is eligible for Medicare due to age, Medicare pays primary when the employer has fewer than 20 employees. If an individual is eligible due to disability, Medicare pays primary when the employer has fewer than 100 employees. In these scenarios, Medicare must be active in order to serve as primary coverage. When Medicare is primary because the employer has fewer than 20 employees, the employer plan may pay secondary to Medicare. The beneficiary should enroll in Medicare when they're first eligible, and the beneficiary should confirm with their HR department how coordination works. If Part B is declined in this scenario, the employer plan is not required to pay first. This could leave the beneficiary effectively without primary outpatient coverage. If Medicare is primary and the beneficiary declines Part B, claims may be denied. The employer plan may stop paying primary, and the employer plan may recoup payments if it previously paid for services as primary. This can result in a significant situation with unexpected medical bills. Advocates should emphasize that declining Part B when Medicare is primary is extremely risky. If someone qualifies for Medicare due to disability and the employer has fewer than 100 employees, Medicare is primary. Enrollment in Part A and B is automatic after 24 months of SSDI, and the beneficiary should maintain Medicare. Job-based plans that are secondary to Medicare do not have to provide identical benefits to Medicare eligible individuals. Understanding this distinction protects beneficiaries from really costly mistakes. There is an important exception to understand when Medicare is primary and job-based insurance is secondary. Job-based insurance plans that are secondary to Medicare do not have to provide identical coverage to employees who are eligible for Medicare. In other words, employers are allowed to structure benefits differently for Medicare eligible employees. This means coverage may not mirror what non-Medicare eligible employees receive. Some services may coordinate differently, and out-of-pocket costs may vary. Advocates should always encourage beneficiaries to review their summary plan description and speak directly with their HR department to confirm how their coverage works once Medicare eligibility begins. Now we shift to the opposite scenario when Medicare pays secondary. So if someone is eligible for Medicare due to age and their employer has 20 or more employees, the employer plan pays primary and Medicare pays secondary. If someone is eligible due to disability and their employer has 100 or more employees, the employer plan pays primary and Medicare pays secondary. In these cases, the beneficiary may not need to enroll in Medicare Part B immediately, but careful planning is essential. When Medicare is secondary, the individual already has primary coverage through their current employer. Because of that, they may delay Part B. They may also use the Part B special enrollment period later. Many people enroll in premium free Part A, but they delay Part B to avoid the monthly premium. However, they must understand the rules for the special enrollment period so they do not accidentally trigger penalties. The special enrollment period is you can delay enrollment and use the Part B special enrollment period for up to 8 months after they no longer have job-based insurance. This chart summarizes what we've discussed. If you're 65 and older with fewer than 100 employees, Medicare is primary. If you're 65 and older with 20 plus employees, then employer is primary. For disabled beneficiaries with fewer than 100 employees, Medicare is primary. And for disabled beneficiaries with 100 plus employees, employer is primary. This chart is a quick reference tool. Advocates should internalize the structure because employer size is the key decision point. Jen works full time as a restaurant. For most of the year, the restaurant has 15 employees. During busy months, it increases to 25 employees for about 5 months. She recently turned 65 and plans to continue working. So the question is, does her employer insurance count as primary? This scenario introduces the 20-week rule, right? So the answer is Jen's employer is primary. So yes, Medicare uses what we call the 20-week rule for age-based eligibility. If the employer has 20 or more employees for at least 20 weeks during the calendar year, the employer plan is considered primary for the entire year. Because Jen's employer has 25 employees for 5 months, which equals 20 weeks, her job-based insurance is primary. She should confirm this in writing with her HR department. Now we transition to the Part B special enrollment period, or SEP. This is one of the most important protections for individuals who delay Part B because they have coverage from current employment. Misunderstanding this SEP is one of the most common causes of lifelong Part B penalties. The Part B SEP allows individuals to enroll in Part B outside of their initial enrollment period without penalty if they had coverage from current employment. The SEP begins while the individual has job-based insurance from their current work and ends 8 months after employment or coverage ends, whichever occurs first. The key point is the 8-month clock does not wait. To qualify for the Part B special enrollment period, two conditions must be met. The individual must have insurance from their current work, their own, their spouse's, or sometimes a family member's job. They must not have gone more than 8 consecutive months without Part B or qualifying job-based coverage. If either condition is not met, the SEP does not apply. An individual becomes ineligible for the SEP if they go more than 8 consecutive months without Medicare Part B or coverage from current employment. Short gaps are allowed, but once 8 consecutive months pass, the SEP is lost. At that point, they must wait for the general enrollment period and may face penalties and coverage delays. Documentation of coverage history is critical. To enroll using the SEP, the beneficiary must submit two forms to Social Security. CMS 40B is an application for enrollment in Medicare Part B, and CMS L564 is a request for employment information. The CMS L564 must be completed by the employer to verify job-based insurance, Without this form, Social Security will not process the SEP correctly. Employer size does not affect SEP eligibility. Even if Medicare was primary because the employer was small, the individual may still qualify for the SEP. An exception is if eligible due to disability and covered through a family's employment, that employer must have 100 plus employees. Also important is that COBRA and retiree insurance do not count as coverage from current employment, which is a common misconception. All right. So when someone is enrolling in Medicare Part B during a special enrollment period because they had job-based insurance, there are two key forms that must be completed and submitted to Social Security, as we spoke about. The first form, which is the application for enrollment in Medicare Part B, is the actual request to enroll in Part B. The beneficiary completes this form and indicates when they want their Part B coverage to begin. It's important to be clear about the requested effective date to avoid gaps in coverage. The second form, the CMS L564, is the request for employment information. This form provides proof that the beneficiary had active job-based coverage based on the current employment, either through their own job or a spouse's job. This documentation is what allows the person to qualify for the Part B special enrollment period and avoid late enrollment penalties. The beneficiary completes the top portion of the L564 form, but the employer must complete the bottom section. The employer is certifying the dates of employment and confirming that the beneficiary had group health plan coverage tied to their employment. If the beneficiary worked for multiple employers or had coverage through more than one employer during the relevant time period, they will need a separate L564 form completed by each employer. Social Security needs documentation covering the entire period of creditable employer coverage. These forms are typically submitted to the beneficiary's local Social Security office, either by mail, fax, or in person. Importantly, beneficiaries also have the option to apply online using Social Security's Medicare Part B online application. The link is included on the slide. The online process can be faster and may reduce processing delays, especially when individuals are trying to coordinate Part B with the end of employer coverage. As advocates, it's helpful to remind clients to keep copies of everything they submit and to confirm receipt with Social Security when possible. Ideally, beneficiaries should enroll in Part B 1 to 2 months before losing job-based insurance. In most cases, Part B begins the first day of the month after enrollment paperwork is submitted. If still employed or within the first month after losing coverage, they may choose the effective date. Planning ahead really prevents coverage gaps, so it's important for beneficiaries to plan ahead. Here's another case example. Liz delayed Medicare cover while covered by job-based insurance. She changed jobs twice and had short coverage lapses, 3 months and 2 months. So she's currently working and plans to retire soon. Does she qualify for the Part B SEP? Yes, Liz qualifies because she never had a gap of 8 consecutive months without job-based coverage or Part B. Short gaps do not disqualify her, as we spoke about in a previous slide. She should retain documentation of her employment and have each employer complete a CMS L564. Okay, Medicare and COBRA. COBRA. So, a little bit about COBRA. COBRA allows certain employees and dependents to continue employer health coverage for 18 to 36 months after leaving a job. The individual must pay the full premium, and COBRA typically applies to employers with 20 or more employees. Importantly, COBRA is not coverage from current employment. If someone becomes Medicare eligible while on COBRA, COBRA usually ends once Medicare begins. Medicare is always primary, and COBRA does not provide access to the Part B special enrollment period. If someone already has Medicare and later becomes eligible for COBRA, they must be allowed to enroll in COBRA, and Medicare will remain primary. Individuals with COBRA should enroll in Part B during their initial enrollment period. If they don't, COBRA may pay as if Medicare were primary, and COBRA may later recoup payments. So, to avoid penalties, enrollment must occur during the initial enrollment period or within 8 months of losing job based coverage. COBRA coverage may terminate if the individual becomes eligible for Medicare, the maximum coverage period ends, premiums are not paid, the employer stops offering coverage, or the individual obtains other job based insurance. Advocates should verify termination triggers carefully. Now, here is a case example. Kendall received COBRA coverage after retiring in March 2025. She is 64 and she's turning 65 in May 2026. When should Kendall enroll in Medicare coverage? In this scenario, Kendall should enroll in Medicare during her initial enrollment period or IEP. The initial enrollment period is a 7 month window. It begins 3 months before the month she turns 65, includes her birthday month, and continues for 3 months after. In Kendall's case, the IEP runs from February 2026 through August 2026. If Kendall enrolls during the first 3 months of her IEP, meaning February, March, or April, her Medicare coverage will begin on May 1st, which is the first day of her birthday month. Enrolling early is important because it ensures there's no gap in coverage. It's also critical to understand that Kendall is not eligible for the Part B special enrollment period for job based insurance. The Part B special enrollment period is only available to individuals who are actively working or covered through a spouse who is actively working at the time they become Medicare eligible. So, because Kendall retired before becoming Medicare eligible and is covered through COBRA, she does not qualify for that special enrollment period. This is a common point of confusion. COBRA is not considered current active employment coverage for Medicare purposes. Therefore, COBRA does not allow someone to delay Part B without potential penalties. Until Kendall becomes eligible for Medicare, her COBRA coverage will continue to pay primary because she is not yet Medicare eligible. However, once Kendall enrolls in Medicare, COBRA coverage will generally end. Employers are allowed to terminate COBRA once an individual becomes entitled to Medicare, and that means Kendall needs to carefully time her Medicare enrollment to avoid any gap between COBRA ending and her Medicare beginning. The key takeaway here is that COBRA is temporary and does not replace the need to enroll in Medicare during the initial enrollment period. Retiree insurance. Retiree insurance is coverage provided to former employees after retirement. It almost always pays secondary to Medicare, and it is not considered current employment coverage. Some retiree plans require enrollment in Parts A and B. Retiree coverage may cover Medicare cost sharing. It may offer creditable drug coverage, and it may cover services Medicare does not. Plan documents should be reviewed carefully. If someone has retiree insurance and is Medicare eligible, Medicare is primary and the retiree plan is secondary. If Part B is declined, the retiree plan may recoup payments and the individual may have no primary coverage. So, to avoid premium penalties, the individual should enroll in Part B during their initial enrollment period or their Part B SEP. Some employers offer Medicare options specifically for retirees who become Medicare eligible. This may be a Medicare Advantage plan sponsored by the employer or a group Medigap policy that works alongside Original Medicare. These plans are often designed to coordinate Medicare benefits with the employer's retiree health insurance, sometimes wrapping additional benefits around Medicare. In some cases, employers require retirees to enroll in their sponsored Medicare Advantage plan in order to continue receiving retiree health benefits. Retirees do have the option to decline the employer's coverage and instead enroll in Original Medicare or choose a different Medicare Advantage plan. However, an important caution is if they decline the employer-sponsored retiree coverage, they may not be able to re-enroll in that retiree plan later. Decisions about retiree coverage can be permanent. So Beneficiaries should really review their options carefully before opting out. Other types of retiree coverage. So TRICARE for Life um, requires enrollment in Medicare's Part A and B. Medicare is primary, and TRICARE for Life is secondary. Veterans Affairs benefits. This is a U.S. Department of Veterans Affairs benefits. They don't coordinate with Medicare. VA covers care at VA facilities, and Medicare covers care at Medicare certified facilities. VA does not pay Medicare cost sharing. Federal Employees Health Benefits Program. If you're enrolled in Part B, then Medicare is primary and your federal employee health benefits is secondary. So if you have federal employee health benefits without Part D and you're not enrolled in Part B, then your federal employee health benefits pays primary. If enrolling later, the individual may face a late enrollment penalty and coverage gaps. This chart summarizes coordination for employer retiree insurance, FEHB, TRICARE for Life, and VA benefits. Review carefully because each has unique coordination rules. Now we shift to coordination between Medicare and Medicaid. So Medicaid is a joint federal and state program providing health coverage to individuals with limited income and assets. For Medicare beneficiaries, Medicaid typically falls under aged, blind, and disabled Medicaid. Eligibility rules vary by state. Medicaid may cover Medicare premiums through the Medicare Savings Program, cost sharing, long-term care, dental and vision services, home and community-based services. This is especially important for dual eligible individuals. When someone has both Medicare and Medicaid, Medicare pays first, is the first payer, and Medicaid is the secondary payer, the payer of last resort. Medicaid may cover services Medicare does not cover, such as dental and vision services, home and community-based services. If someone has the qualified Medicare beneficiary status through the Medicare Savings Program, they cannot be billed for Medicare cost sharing. Providers have to accept Medicare and Medicaid payment as payment in full. All right, so we have some resources to share. The Medicare Rights Center National Helpline is available to clients who have questions about Medicare. Our number is 1-800-333-4114. We also have technical assistance for child advocates to reach out to us with any specific questions related to Medicare and detail-oriented policy questions that they might have. We can be reached at CHA Network@medicarerights.org. Medicare Rights Center also has a website called Medicare Interactive. Medicare Interactive is designed to guide consumers with understanding their Medicare rights. So it really breaks down these concepts in a more digestible way for them to understand a lot of these difficult and highly complex topics. Medicare.gov is also, a resource for us advocates and also for beneficiaries. Ultimately, in this presentation, we learned how to understand coordination rules in order to prevent coverage gaps, late enrollment penalties, potential billing disputes, and financial hardship. Thank you so much.